Following a balanced diet is one of the best things we can do for our health, but did you know certain foods are more important at different stages of life? 9 News medical expert Dr. Pao Coley is here to break this down for us.
I'm so excited to talk about this. I've noticed that certain foods or alcohol makes me feel different. So talk to us about this concept of eating differently as we age.
Yes, so most of us, what we do is as we get older, we do exactly what we were doing before, right? We eat the exact same things. But I want us to think about the phases of our life like chapters of a book. So you have kids, you have adolescence, you have our 30s, 40s, which is adulthood. Then you have our middle ages, which is 40s to 60s, and then you have older adult. As you flip the chapter, how you eat should be dramatically different. What you eat, even the timings of when you eat.
How do a woman's body, aging body, affect this? Hormones, menopause,
Good
those
question.
sorts of things.
Yeah, so we start to lose muscle mass, ladies, in our 30s. So we've already started to lose muscle mass. So by the time we hit 30, we really ought to be thinking about protein loading. Do you have a sense of how much protein you should be eating every day?
No.
So about 90 grams a day. And the way you want to eat that is spread it out 30, 30, and 30. So what most of us do is eat dinner that's very large, and that's where we consume most of our protein-rich foods. And so we end up being protein deficient. So as a woman's body ages, protein is one of the biggest things she needs to do. She also starts to lose bone density as she gets older, especially perimenopause, postmenopause. So vitamin D and calcium, really important to make sure you're enriching in your diet. And you know, we tell our kids they need to eat high-fat foods because their brains are developing, their bodies are developing. We tell our teenagers they need to eat calorie-dense foods. But when we get into our 30s and 40s, our metabolism starts to slow down. So it's not so much the calories that we need, it's the nutrient density. So the types of foods that we're eating needs to start to change as well.
And you touched a little bit on kids and teens, but what would you recommend they eat? A kid right now, a teen right now? How is that different from what Alex and I would be eating?
It was so funny because they did this fascinating study during World War II where they had to ration out the food. And that allowed us to study how kids' bodies develop. And if a child is not exposed to much sugar, either in the womb or to the first 1,000 days of life, the risk of having cardiovascular disease as an adult, 20% lower. Risk of stroke, 31% lower. So we need to move away from sugars for our kids to really the good, healthy fats that we need to be feeding our kids. And again, lots and lots of calories because they're in the growing phase. They have the growth hormone. With our adolescents and teens, we need to start to shift to more of a Mediterranean diet, but again, a very rich in calories because they're growing as well. The puberty hormones are kicking in and lots of food for brain health. And then in our 30s and 40s, fertility actually is augmented if we start to eat more Mediterranean style food rather than more of a Western style diet that has a lot of ultra processed foods.
And talk to our viewers when you say Mediterranean diet, go in a little more detail so folks know exactly what you're talking about.
Yep, so I'm talking about healthy fats like avocados, I'm talking about whole grains, I'm talking about lots of seeds and nuts, I'm talking about good fish like salmon or tilapia, those types of fishes, and try to avoid red meat. And you really want to limit the butter, the lard, the beef tallow, the processed foods. And you want to shift away from carbs because a lot of times when we're on the go, when we're busy, we tend to eat a lot of carbs, but that's really not what we want to do as we get older.
What about our parents, older adults? What do you recommend for them?
So brain health is really important here. So as we age, the bacteria in our gut actually starts to change, believe it or not. So we have less bacteria, less diverse bacteria, less good bacteria, and the way that it ferments our food is also different. So we need to start to shift away from processed foods because it starts to create inflammation if we eat those. We need to eat fewer calories as we age, which again, people don't understand, but we need to make sure that we're eating lots of fiber and lots of protein. And then that brain food is really important. So that's when I say omega-3s. And if you're vegetarian like you are, Sam, or vegan, you can have a hard time sometimes getting those omega-3s, especially as you age. So even in our 40s, we need to start to focus a little bit on brain health and foods that feed our brain. But one thing we cannot do, the biggest mistake I see people making, the same meals week after week. So what I want us to do is sit down and be active about what phase of our life we're in, how our hormones are changing, what is happening to muscle mass, and then really customize a diet based on that.
Really good information. Dr. Coley, thank you.